I graduated from the University of Minnesota in the 1960s. The school was known as the Dust Bowl of empiricism. In other words, we were not enamored by theory. We cared about what works. Based on theory, we thought we could stop Alzheimer's disease once we discovered amyloid plaques in the brain. Will neurological evidence on how the brain handles opiates lead to effective treatments for addiction? Taking opioids leads to taking more opioids, practically the definition of addiction. However, when a user is completely off the effects of the drug, how long, if ever, will it take for the brain to be normal? We already know that it is not easy for an addict to stay clean after months of sobriety. Sex addiction can also be serious, especially regarding pedophiles. We arrest pedophiles and give them lengthy prison sentences. While in prison, they are treated harshly by other prisoners. Why is their recidivism so high? Does testosterone hijack the brain? Apparently, there are no easy answers explaining the relapse of addicts after months of no longer using. Back in the 1970s, most treatment programs taught alcoholics to avoid situations involving alcohol. Cues related to drinking could lead to relapse. My program for treating alcoholics sent them to a bar. I thought if we could teach an alcoholic to be content to drink non-alcoholic beverages in a bar while enjoying the camaraderie of others while talking, dancing, and playing pool, he could avoid drinking anywhere. I believe that addicts become like people with obsessive-compulsive behaviors. Theory says I cannot be right because people with OCD are not impulsive or try to get high. Intensive 4 hours or more of exposure and response prevention is presently the best treatment for OCD. Overcoming Addiction, written by the Harvard Medical School, does not even mention exposure and response prevention as a treatment option, even though several studies have shown promising results. Do drugs hijack the brain? Yes, at least in theory. For an empirical approach, see Improving Addiction Treatment with Data Mining on YouTube. Thank you for listening.